Welcome to my presentation on selective laser trabeculoplasty. I am Abraham Sir, a fellowship-trained glaucoma specialist practicing in San Luis Obispo, California. The purpose of this presentation is to provide a concise overview of selective laser trabeculoplasty, or SLT, and how it can be an option to lower intraocular pressure without medication. A doctor might explain it as a precise and repeatable way to lower intraocular pressure. A patient may say it's relief from constant medication. We need to first discuss the relevant physiology and anatomy, how the eye pressure works and where it functions. The eye has a plumbing system just like a sink or shower. There is a faucet and a drain. The drain is a circular structure located where the color of the eye meets the white of the eye, but it is on the inside of the eye. This graphic illustrates the location of the natural drainage system, which is inside of the eye. The location is called the anatomic angle because two structures come together to form a geometric angle. This next drawing shows a magnified view of the anatomic angle. A doctor uses a special mirror to visualize the angle anatomy. This same mirror is used to direct laser energy onto the surface of the internal drainage system during SLT. With selective laser trabeculoplasty, a beam of light is aimed at a landmark called the trabecular meshwork, which is within the angle. The eye is given numbing eye drops, the mirror is placed, and the procedure is performed. The procedure is delivered through distinct clicks. The entire procedure requires about 2 to 3 minutes to complete. There are no activity restrictions after this quick procedure. For a majority of patients, there is minimal discomfort. For technical information, the laser is a Q-switched, frequency doubled neodymium YAG laser with a wavelength of 532 nanometers. The laser interacts with the tissue in a manner called selective photothermolysis. This is where the laser triggers a biochemical change which leads to the production of molecules called cytokines. Macrophages are recruited to the lasered area. These macrophages, quote, clean, unquote, debris from the drainage channels. It also increases the expression of the extracellular matrix degrading proteins like matrix metalloproteinases and reorganizes the trabecular meshwork's architecture. These changes enhance the drainage of aqueous humor. The only way to manage glaucoma and ocular hypertension is to lower the eye pressure. SLT is one way to lower eye pressure. It's not the only way. SLT can be used as a primary or adjunctive treatment or replacement treatment for open-angle glaucoma or ocular hypertension. It is repeatable if effective and can be effective even on those already on medication. I share with patients how SLT can lower intraocular pressure about 20% in about 8 out of 10 people. A good result lasts about 1 to 2 years, but it can also work for a shorter or longer period of time, or not at all. These are just a few of the myriad of studies looking at the effectiveness of SLT. The most recent study with robust results is the LIGHT trial in 2019, which recommends SLT over medication for effectiveness, safety, and cost savings. SLT has an excellent risk-benefit profile. It is common for everyone to have mild inflammation after the procedure, which can make the eyes feel achy, and it usually lasts 1 to 3 days. If the achy feeling is severe or longer lasting, it can be effectively treated with a short course of non-steroidal or steroidal eye drops. A temporary intraocular pressure spike can occur in about 5% of patients, which usually resolves within 24 hours. It is typical to pre-treat with an intraocular pressure-lowering eye drop at the beginning of the case. Also rare but possible is swelling on the cornea and or the retina, and we want to avoid performing this procedure in patients who are at risk for complications. Also, the anatomic angle needs to be open and without specific findings. A thorough eye exam with gonioscopy can help determine if someone is a good candidate for this procedure. There are variations of the same procedure. Argon laser trabeculoplasty was the first laser trabeculoplasty procedure where an argon or thermal laser creates heat to shrink tissue and therefore expand adjacent areas. However, it can cause scarring in the drainage angle, potentially limiting its ability to be repeated. Micropulse laser trabeculoplasty is similar to argon, but the laser is quickly pulsed on and off instead of continuously to provide a lower intensity laser energy, which allows the tissue to cool. MLT aims to lower eye pressure with less inflammation and tissue scarring than traditional methods. Pattern scanning laser trabeculoplasty, or PASCAL. This method uses the laser, which is delivered in a computer-guided pattern, short pulse durations, resulting in a 100 micrometer spots that may decrease surrounding tissue damage. Titanium sapphire laser trabeculoplasty. This technique uses near-infrared energy to target deeper areas of the drainage system, such as Schlemm's canal. Direct selective laser trabeculoplasty is the newest version where the same type of laser used in SLT is applied. A mirror is not used, and the laser is applied to the surface of the eye at the appropriate landmarks. There is a higher power setting in order to penetrate the outer wall of the eye in order to reach the trabecular meshwork inside of the eye. It is extremely fast. This treatment is completed in a few seconds compared to a few minutes. Robust side-to-side comparisons of direct SLT compared to SLT are not readily available at the time of when this presentation was created. So in conclusion, SLT is one of many ways to lower intraocular pressure. It is safe, effective, and a repeatable option for open-angle glaucoma or ocular hypertension and can be just as effective as medication eye drops. However, SLT does not cure glaucoma, and the eye pressure lowering effect will wear off with time. Whether you're a patient seeking relief or curious about options, your best source of advice is by consulting a medical doctor trained in the specialty of ophthalmology and further completed a fellowship in glaucoma. The American Glaucoma Society.net website has a Find a Doctor function. Thank you for watching. Like, subscribe, and share your experiences.